Yes, a lot of times and a lot of women have been concerned and asked so much about an IUD. And they have been so much confused about family planning and they don't know which one to take, which family planning to go for and which one to leave. Specifically, today we're going to look at IUD, or what we call intrauterine device. An intrauterine device is a family planning that is easily reversible and has a long-term effect of up to 10 years. It has types, and in this video specifically we're going to look at the types of IUDs. We look at the people who have to get it or who people can benefit from getting it. We look at the people who should not get it. We look at the advantages of having the IUD and the disadvantages of having the IUD and the common side effects of an IUD. Stay tuned. Hello good viewer, welcome to Dr. Malik Discussion Show, a channel where you learn about your health wherever you are at zero cost. So today we are looking at the IUD, or an intrauterine device. Why is it called intrauterine? Because it is a device, a small device that is put into a woman's uterus. That is why it is called intrauterine device. And through different mechanisms, it prevents and protects a woman against getting pregnant. Like I said, it protects someone up to 10 years without getting pregnant. What are the types of IUD? We have two specific or two main types of IUDs. And these types mainly are in the category of how they work or the active component in them. We have the copper IUD. The copper IUD specifically, this is not hormonal and it contains copper spiral that can be used. And two, we have a hormonal IUD. This is mainly hormonal based. So having looked at an IUD, what an IUD means, where it is put, how it is put, and the types involved or the types that are there, let us look at the advantages of this type of family planning method. Number one advantage, the first and very first number one advantage of this type of family planning is it is easily reversible. Easily reversible in a sense that anytime that someone wants to get pregnant, they can just remove the device and someone conceives without a long wait, without so much trying. So it is easier, very easier for someone to regain fertility after using this type of family planning method, especially if it were a copper type. The second advantage, or advantage number two, this type is long term and very stable. Long term in a sense that it can reach to an extent of 10 years in a woman's uterus, in a woman's body, when it is still functioning very well. So it is long term and stable. Advantage number three, this type of method has an immediate onset. That means even if someone had unprotected sex and they got it within 72 hours, it would still effectively reverse the effects, or it would still work immediately. So its effect is very onset, is very immediate, and that is a good advantage. Reason number four, this type of family planning is user friendly. User friendly in a sense that it can be used by anyone, right from the young age up to the old age, from the teens up to the old age. So it is very, very user friendly and can be used by anyone. Advantage number five, the fifth advantage, this type of family planning has a very high effective rate. It is highly effective, up to 99% protective, especially in the first 5 years of using it. So it is very, very effective, especially the first 5 years. It is 99% effective at protecting someone against pregnancy. Advantage number six, this type of family planning is highly flexible. Highly flexible in a sense that it is easy to administer, it is easy to put, and still easy to remove at any point. And also, the owner or someone who has it does not need to swallow medicines every day. They don't need to swallow or to do other protective measures. It itself is highly effective and still at the same time convenient and reliable at the same time. So having looked at all that are the advantages of this type of family planning or the IUD. Now let us look at the people who cannot use it. Who are the people that are contraindicated, or who are the people that would not benefit from using this type of family planning method? Number one, if a woman has been having or has a PID in the past 3 months, or they've had history of PID in the past 3 months, they should not go in for this method. Why? Because PID is pelvic inflammatory disease. Being a disease in the pelvis or the reproductive system, and it's the same site where this type of family devices has to be put, there are chances that it can aggravate or increase the risk of not healing or the side effects or the complications of PIDs. So this type of method is not ideal for someone who has a PID or who has had the history of the same in the past 3 months. Category number 2, if anyone suspects to be pregnant, they should not attempt to use this type of family planning unless ruled out. Why? Because this type of family planning goes directly into the uterus, is put directly into the uterus, the same house, the same location, the same place where the baby sits, or the same place where the fetus, the fetus sits. So it is highly recommendable that whoever that wants to get this type of family planning should first do a pregnancy test to rule out pregnancy before it is applied. Category number 3, people or women who have undiagnosed dysfunctional uterine bleeding. Any woman who has bleeding that has not been diagnosed to identify the cause, to identify the source of the bleeding and why the bleeding is there, should first be diagnosed and treated before applying or before going in for this type of family planning, because bleeding comes in the same site or same location where this type has to be put. So we have to ensure that there is no cancer or any malignancies there before we apply this type of family planning. Category number 4 of the people who don't have to use this type of family planning. These are the people who, or I mean the women who are at a high risk of getting STIs. STIs like gonorrhea, like chlamydia, and all those others. Why? Because, for example, women who have multiple sexual partners, because at the end of the day, you will end up getting PIDs and other inflammatory diseases in the pelvic region. So it is highly not recommendable for people who are at risk of getting STIs. Category number 5, any woman who has a suspected cancer, for example, cervical cancer or uterine cancer or ovarian cancer, should not attempt in to use this type of family planning. It is contraindicated since it is going in the same place as where the malignancy is. And still, for example, if you're using a hormonal IUD, it wouldn't be advisable. Category number 6, women who have heavy bleeding are contraindicated or are not allowed or would not benefit from using this type of family planning, because we need to first work on your bleeding, to first ensure that the bleeding is controlled, and first ensure that source of that bleeding before we apply in this type of family planning. So women who have heavy bleeding are also contraindicated from using this type of family planning. Now, having looked and having seen the outlay and the importances and the advantages and the contraindications of this type of family planning, let us look at the disadvantages of this type of family planning. Number 1, the very first disadvantage is it does not protect against STIs. Yes, If you're using this type of family planning, you're not protected against STIs. You can easily get syphilis, you can get HIV, so it has no any protective measures against STIs the way a condom would do. Number 2, there is mild cramping. There is mild lower abdominal pain on administration of this type of family planning, especially for the first 3 to 5 weeks. For the first 3 to 5 weeks, there is that type of lower abdominal pain that comes because your uterus or your body is trying to adjust onto getting used to living with this type of device within it. Number 3, heavier and longer bleeding. This happens usually in the first 3 months of using this type of family planning. This does not happen to anyone, however, it may happen. And when it happens, there is always a way of treating it in the hospital by your doctor. So if you get heavier or longer periods, for example, where you've been getting 3 days of periods, you end up getting 6 days, you talk to your doctor, there is a solution to counteracting the effects. Number 4, there is spotting and bleeding between periods. This is usually common, especially the people who are using hormonal T or hormonal IUDs. There is that spotting or bleeding in between periods. So that means if you finish your periods today, you might get some spotting after a week or 2. Then after that, you get your periods again after, depending on your cycle. Number 5, there is increased cramping pain when you are in your periods. Remember remember where this device is put. It's put in the uterus. In the uterus, the same place where your bleeding comes, and in the same place where cramping happens. So that means there are chances of aggravating the pain because of this type of family planning. However, still, if the side effect is there, it can be controlled. It does not happen to everyone. However, when it comes, it can be managed. Number 6, what we call secondary amenorrhea or missing of periods. So there is chance of missing of periods, and when this happens, don't worry. This is one of the common side effects that happens, especially someone who is using a hormonal type. It does not happen so much in the people who use copper T. However, in the women who use hormonal, it is common and it is expected. And when it happens, you should not worry so much unless the secondary amenorrhea or missing of periods has come with some other effects that you think are not good. Then you can see a doctor. So now let us look at the common complaints or the common side effects that come with this type of family planning. What are those common side effects that come? A lot of people talk about side effects and are so much interested in knowing the side effects. So let us look at the side effects. 1, there are chances of a false smearing discharge from your genitalia or from your vaginal canal. However, it does not happen to everyone, and when it happens, it can still be controlled. Another side effect is severe lower abdominal pain. Severe lower abdominal pain is one of the common side effects that happen to people, and still it can also be controlled. Like we had looked at in the disadvantages, we can also expect someone to get secondary amenorrhea or missed periods. The other common complaint of the other side effect, we would also expect some people to get a misplaced IUD. These ones are usually the ones which have taken long there or which have taken longer than they should there. Usually they come out misplaced. The other common complaint is missing strings. This also happens to people who have taken long with the IUD, more than 5 years. And lastly, prolonged bleeding, like we had looked at in the disadvantages. There is also a risk or a common complaint of prolonged bleeding when used this type of family planning, especially the hormonal type, or if it's a copper T, especially in the first 3 months of using it. However, any of these side effects, if happened, they can all be controlled.